Sometimes we don't know how we affect individuals until sometimes maybe much, much later where we see it from them or we hear a family member tell us.
Hi, I'm Dr. Keshishian. Welcome to our podcast series, House Calls with Dr. K. During this podcast series, we're going to talk about a lot of different things, but specifically it's about medicine, the human side of medicine. We all have questions about our health, and who can you turn to? The doctors that you trust.
Hi everyone, welcome to this week's episode of House Calls with Dr. K, where we will be talking about all things recreational therapy for Recreational Therapy Month. Today we are joined by Christina Randall Webster, Josephine Ho, Christina Burgos, and Gracie Gonzalez. Hi everybody.
Good morning.
Hello, good morning.
And you all are recreational therapists, correct?
Yes, we are.
And we have lots of different years of experience amongst the group.
Correct.
Chris, why don't you start us off and tell us a little bit about yourself?
Well, I have almost 27 years experience between psych and rehab and community service, and began 94, 95 with working for LA City Rec and Parks for about 8 years before I came into the hospital clinical settings.
And Gracie, you work with psychiatry as well. Can you tell us a little about yourself?
Yeah, so I've been doing this for about 7 months right now, so I'm just fresh off the boat right now. So still got a lot to learn, but it's been a great experience.
And Christina, you are also one of our supervisors on the rehab side.
Yes, I've been a recreation therapist for 23 years. I started at age 10, very talented. And I have actually, my first job as a recreation therapist was at Rancho, and I'm still there. And yes, I love it. Haven't left.
And Josephine, you work with Christina, right?
Yes, I do. I'm one of the newer rec therapists there. I've been with Rancho for 8 years, and I worked at also another hospital before that. So I've been a recreation therapist for a total of 9.
That's amazing. And so the month of February is Recreational Therapy Month. And there are a lot of people that don't know exactly the wonderful things that recreational therapists do. Can you tell us a little bit about what is recreational therapy?
With rec therapy, we look at so many aspects to a person. We're looking at the social, we're looking at the emotional, we're looking at the cognitive, we're looking at the physical, and we're using leisure as a modality to help improve all of those. The ultimate goal is to have the people that we work with live a better quality of life and to be as independent as they can.
Mm-hmm. And how do you help with that independence?
We motivate, we encourage, we teach, and we are just there as a support system. In physical rehab, a lot of our patients are there because of a traumatic incident, a disabling incident, to where maybe they don't feel as confident, a day before they were walking, the next day they're in a wheelchair. So it's us as a recreation therapist to really encourage and motivate and say, you know what, you can still do the same things. We may have to adapt it in a different way, but you can continue to do everything that you enjoy doing. So one of the things that we do as rec therapists, we do an initial assessment. And on those initial assessments, we're looking at pre-morbid leisure activities. So once we find what those activities are, we're able to incorporate it in our treatment plan to really focus on the goals that the patients have. So it's really patient-oriented and goal-oriented.
In psychiatry, because the patients and individuals that we're dealing with are not necessarily physical conditions, it's more cognitive, behavioral, and of course with the mental illness. So we're looking at how can we help the individual deal with life stressors, how to deal with life itself. And it can be from a loss, as Christina was saying. Not only are individuals who have suffered a stroke or some kind of debilitating physical accident, incident, but they have to process that. They can't just move on to something else to start walking, because it's a loss of whatever they have gone through, whether it's a head injury or a stroke. For individuals with psychiatric mental illness, it's a loss of being able to go outside. You have all these new fears and paranoias, and they've lost relationships, unable to interact with other people. So afraid to even go outside. So how can we assist them as encouraging individuals to look at what are their stressors, what are some of the things that they're afraid of, and work with that individual in a safe space, create a safe environment for them so they can practice and talk about it, and then slowly encourage them to work on those. Let's go outside. Let's go to the store. Let's do an activity outside that you have been afraid to do. And as we increase their confidence, they start working with other individuals, and we can slowly see them socialize with them and develop these little pods of friendships that they can do things outside of the treatment area. And that's our goal, is to develop independence and have them be as flourished as they could possibly be and independent in their life at their level. We also understand that patients are not going to be ever maybe at 100%. So let's look at what you can do and work from there. Let's build from there on the things that you were interested in before, because everything can be adapted and modified so that you can continue doing the same level of activities and fun things that you were doing previously.
So it sounds like you're meeting the patient where they're at and trying to see where they want to be and helping them get there.
Correct.
And Gracie, you work in the emergency room, in the psychiatric emergency room. That's a totally different venue. Can you describe the work that you do there?
Yes. So the work that I do there is kind of like where I meet the patient firsthand, kind of like at the beginning stage of their lowest point, per se. So what I bring is kind of introduce them to what recreational therapy is, and kind of a lot of patients don't really know what that is. So I'd like to introduce it to them and kind of, like Chris mentioned before, like meet them at their point. And okay, well, if you're going through this, how can we go from there? And bring an activity and kind of start with them and work with them and begin developing that relationship with the therapist and the patient. Because sometimes they can be a little bit agitated, they can be irritable. So it's kind of like, okay, I'm going to meet you where you're at, and where can we go from there? Where can we start with a simple activity, as something as playing with checkers, as a coloring activity? We can meet them and help them with their coping mechanism and skills.
Now, you mentioned activities. Most of the work is done through different types of activities with a therapeutic purpose. Is that correct?
Yes. Mm-hmm.
And so can you maybe describe some of the activities that you engage in with patients?
So we'll take an activity as easy as a creative expressive activity, an arts and craft activity. So a person looking in may see a patient painting, oh, that patient is having fun, that patient has something to do with their spare time or whatnot. But in actuality, as a therapist, we're looking at so much more. We're looking at eye-hand coordination, gross motor skills, fine motor skills, looking to see if the patient can follow 1 to 2 step commands, directions. Usually they're in a group, so how is that individual socializing with other peers within the group? So there's so much that we as a therapist look at, and I like to think of rec therapy as an undercover therapy. There's so many times where perhaps the patients don't want to get out of bed or they're in pain. If they're engaging in a meaningful activity, they're apt to do so much more. So, for example, if we had a patient that has suffered from a stroke and is now in a wheelchair but loved to play basketball, my job as a recreation therapist, hey, let's get you in the standing frame. We're going to focus on the strength and endurance of your lower extremities, and we're going to shoot some baskets. So a patient that didn't want to do anything because they're in pain, now all of a sudden 30 minutes in, they're shooting, baskets, and they don't want to stop because it's a meaningful activity and it's fun and it's really focusing on getting better and getting their strength and endurance back.
Thank you for explaining that. So well explained.
I was just going to say, one of the things, just to kind of differentiate, because we do creative expression as well, and what we are looking at a bunch of different things that people could say, oh, that just seems to be the fun and games people, right? So I love to use the example of the game Uno. Simple card game. People look at it, it's like, oh, really, what's therapeutic about that? However, when you look at it, there's different stages. Okay, can a patient or an individual follow the color sequence? Because the game it's either the same color or the same number, different color. But that's quite a bit to remember for individuals who are having cognitive problems or are unable to focus and just kind of pay attention. So they're just kind of randomly throwing different cards down. And as they get better and have more problem solving skills and maybe can strategize, then you throw in some of the specialty cards. But then you're also looking at how are they doing interacting with each other? Are they getting angry? And if they're getting angry, this is a good way of stopping and say, okay, what's making you so angry? Because it's not always necessarily the game. There's usually always an underlying issue of why somebody's getting angry, you know, and we can work through them as we see them getting agitated or they want to quit. And this is another game where you could also look at, do they have the coordination? Can they hold on to the cards well? In psychiatry, you also deal with patients on a lot of medications that may cause tremors, that may cause some other side effects. So we're also looking at, are there any other side issues that are happening that we may need to report back to the doctor or to the pharmacist to say, this is what we noticed with the patient was excessively shaking, or they were having a hard time staying awake. So then this is where, as a treatment team, everybody can look at, okay, what is going on with this patient? And if it's medication, you know, can we make adjustments so that they can participate?
So that's why you always want to play Uno with me. I understand now better.
Okay.
What the motivation is.
What can I say? It's also just winning.
Oh, is that right? Okay, very
right.
good. Well, it sounds like a lot of different people can benefit from the services that a recreational therapist provide. In what kind of different patient teams or treatment teams do you usually participate in? And what is your role in the team?
In terms of teams, so we work with everyone, including just, you know, occupational therapy, physical therapy, speech, social work, nursing. So when we have team meetings, it's really, we gather weekly to, you know, discuss the patient status, discharge status, and really this is like the perfect time for everybody to come together and, you know, just say, hey, like, where's this patient at? What can we do to, you know, help him, motivate this person, and eventually just overall safe discharge back to where, you know, they can get back to their life and still have a high quality of life as close to normal as they, you know, were having before their injury.
You mentioned different team members, and thank you for doing that. Can you tell us a little bit about the differences between, for example, like you said, an occupational therapist or a physical therapist versus a recreational therapist?
Well, so this is my definition. So for physical, so if you're asking about the different therapies, for physical therapy, they really work on the entire body, like physical, gross motor, walking. So, and occupational therapy works on the activities of daily living. So things that people have to do daily, like grooming, even making a cup of coffee. And what I love about recreation therapy is that we, as our own discipline, we can do our own treatments. However, what we have a lot of pride in is being able to co-treat with, you know, occupational therapy and physical therapy. So let's say this patient is interested, you know, in going back to like kicking a soccer ball. Like, well, as recreation therapists, we are not capable of completely getting a patient up and standing. So then we ask physical therapy, like, hey, can you guys co-treat with us? And, you know, we work together as a team, and they help the patient stand, and then we provide, you know, the activities and the supplies, and it all together, it just brings in so much more motivation for the patient, as, you know, as well as doing something they're enjoying while they're trying to strengthen themselves.
And one thing to piggyback off of that, I'll take an example of community reentry. So we do a lot of community reentry. So what I tell the patients is that everything that you're learning in all your therapies, we're going to apply it to a real life setting. But the special thing, because we're highlighting recreation therapy, the special thing about recreation therapy is that we take a little bit from every discipline. So when you're on that outing, you are practicing ambulating, you're practicing wheelchair mobility. If we go to the mall, I'm giving you a map, and you have to find where, let's say, a Claire's is. So you're really focusing on that as well, cognitive skills. If I give you $10, you're going to need to be able to budget your money when you buy lunch. You know, you're going to need to be able to ask employees questions. So you're working on your speech. So everything that encompasses just all of the disciplines, rec therapy is applying them to a real life setting. So I think that's what just makes us unique.
To go off what Christina and Josephine were saying, recreation therapy really focus on 5 main domains, and not just solely on just one area. As Josephine was saying, with physical therapy, it's really largely the mobility, getting them back. Recreation therapy really focuses on the 5 domains are the physical, the cognitive, the social, the emotional, and just the ability to be able to encompass, because you have to think of a whole person. When one section is wrong, it does affect everything else. And you have to be able to work with everything to get a person whole again, because if you're missing one portion, a person can't walk again. They're still dealing with the emotional aspect of that. So if that doesn't get worked on, they can go on walking, but they still are dealing with all the emotion parts. So in our community trips, as she was saying, Amber, who is our recreation therapist who functions and leads the outpatient program, she creates an environment where patients feel safe to come to. It's very scary to come to a group setting. And this is not an inpatient, this is outpatient, so it's voluntary. And we're getting patients from many years of dealing with mental illness, from beginners, first break, to first hospitalization, to some of the older folks, as we call our time, we're like the old timers. And it's very helpful because here we have peer support. It gives encouragement. It's a safety area where they can discuss their fears, their concerns, what really is bothering them, and they can work on those issues here in this safe environment. And then, as Christina was saying, they take everything that they've learned and they go out. We've helped patients get back to work, go back to school, when they get to that place of comfort and confidence and their self-esteem, and they're assertive, and they go out there and they come back and say, hey, this is what I did, then we know that we've done our job. And sometimes it's one of those where we don't know for years, we don't really know, the outcome of how a patient or an individual that we've worked with, what the benefits are for them, and we can see it, but to have them come back and say, hey, this is what we did, and what you did, it's really hard work, and didn't realize how hard it was to get people together just to go to lunch, and it takes a lot of coordination from teamwork, from the rehab side, when they're all working together, to get a patient to a place where they feel comfortable to be able to be their own person now with their new, whatever it is, new wheelchair, being able to go out in public. That also is very emotional to, some people have a very hard time. I don't want to be seen in a wheelchair. I don't want to be seen walking with a cane, and how can I do that? So it's very rewarding to be able to see patients be successful, especially once they get to a community-based program and we can see them go back out there again.
I mean, it's very clear you do so much for our patients. Can you maybe provide us a little bit about the history of how recreational therapy started?
Recreation started soon after World War II, during World War II. In the 40s and 50s, this was in the aftermath of World War II, where the Red Cross workers were providing recreation for the injured soldiers. And then as time progressed, it became known as hospital recreation, that moved towards the VA hospitals. And from there, it has moved down a line to therapeutic recreation. We now have 2 certification boards for all of the recreation therapists. CBRPC, which is California Board of Recreation Society, certifies for state certification, and then NCTRC is for national certification. So we have 2 certification boards that now, and this has progressed over time for the recreation therapy field.
How interesting.
And then we could take it back even further to the 1800s and the Crimean War. And Florence Nightingale, who we all know,
yes,
she was really coined the mother of recreation, as she was able to supply recreation activities to the people of that war, and then, like you said, World War I and the Red Cross and whatnot. And then we jumped to the 1970s, where you had the Rehabilitation Act, and that was the first law that really recognized recreation therapy in a rehabilitation setting and really recognized the significance in rehab. And along with what you said, though, so we've come a long way. We've grown. We're continuing to develop. We're continuing to evolve, and even the practitioners, we're continuing to evolve on our doctrine and really what we're honing in on. And really now we're really focusing into like integrative medicine, so like what Chris says, we're looking at the person as a whole, but we're getting into relaxation and guided imagery and Tai Chi because we really want to work on the mind and the body and the soul. So RT is going in the right direction, and we're expanding.
Yes. And it's found in all different areas. It's not just in the rehab hospitals, the psychiatric hospitals, it's in the community settings, it's in after school programs, it's in the school system.
And the new, I was just going to say, with the newer generation, they're able to think outside the box. So the staff are always coming to me with ideas that I've never thought of. And I'm like, you know what, let's do it. So the new generations, they do have new ideas, and they're excited to try new things. So I love the mixture of both.
Having the newer generation that are really just creative and have, like she said, just full of ideas, and it's like, okay, let's do it.
Now, you mentioned creativity, you all did, and I'm sure that these creative strings have been challenged during the pandemic. How has the pandemic changed the way that you practice and the services that you are able to provide for our patients?
I can talk a little bit about some services that, due to COVID, we unfortunately had to put a pause on. So one thing that we haven't talked about is our, especially our Rancho, is our community-based program. So we have the Adaptive Outdoor Adventure program. We also have a wheelchair sports program, which we've recently started practices again. But as for the Adaptive Outdoor Adventure program, this is where we were talking about how we're promoting independence, promoting, just an outpatient or someone, that has been somewhat related to Rancho in a way in terms of their current outpatients or past Rancho patients. And the way we try to keep them more motivated is we have activities or just different types of sports on a monthly basis. So it ranges from, like adaptive rowing to therapeutic horseback riding to adaptive cycling to even rock climbing. And there's so much more just based on the season. Unfortunately, since COVID, we are not able to do activities in a community setting. The way that it's challenging is for our community patients, this is something that they look forward to every week. They come out, they hang out with their peers, like this. They actually, communicate with each other outside of it. Say, hey, are you guys going to this activity? So they look forward to this. So now, they're not able to see each other. So it's challenging. I try to reach out to them, just to see how they're doing. What new activities have you guys, started doing with your family? What what's new, what's going on. So we try to, keep them engaged, but that is one thing that has been a challenge. I don't know if you guys have something else to add.
Yeah. Our outpatient program for the first time, our recreation therapy outpatient program for the first time in almost 22 years has been closed. And that has been a devastating blow. The patients, clients, current and former, are the ones who really suffer the most, because this is a place where they come, where they socialize, they feel safe, they know that they can come and express themselves and engage with other like-minded individuals who understand what they're going through. And we were fortunate enough, as we're talking about modifications and changes, to be able to begin a Zoom group. And that in itself was a process. Amber, I call her the saint of patients. She worked with every single one. And the first Zoom group that they had, I believe there was 8 patients. They were ecstatic to be able to not only see her visually, but to kind of see each other and just kind of catch up. So we've been very fortunate to be able to do that. So it's been a huge adjustment, and it's made for people to be really creative on what they've been able to do. And so we've had some newer ideas and fun things that probably would not have come out for this. So there's been some pros and cons, and the pros have been just new ways of being able to reach our patients in different aspects.
At Rancho, we have a fine arts program where we actually hire art instructors from the community to come to teach our patients acrylic painting, watercolor. We as rec therapists, we are there to adapt the activity. We have patients that use mouse sticks, so we're there to help the patient to use the mouse stick and paint. So this is a really big program that we have that was just put to a halt. So what could we do as rec therapists to continue it? So like Chris was saying, we do have a Zoom program, and unfortunately the RTs are not there to help, but some of the patients have been in the past art programs. We've ordered the supplies. We've had bags of supplies ready for them that they can come to the drop-off and pick up, and they have their Zoom classes. And so we just did it as a trial run because we just didn't know how it was going to work out, and it's been great. Since then, we've added 3 other fine arts classes. So you really just have to be creative. And then there's an aspect of the inpatients that, the family members can't come visit the patients, say that they become depressed. So I've gotten more consults and orders for relaxation and teaching them just deep breathing techniques and doing more so guided imagery.
Now, we are recording in the time of a pandemic. We're socially distanced. We are trying to keep separated and be safe. But I want to see if we can try to mimic an activity. Do you think that's possible? So that our listeners can get a glimpse into being part of a rec therapy session.
Yeah, sure.
Absolutely.
Okay, all right. Who's going to run it?
Okay,
What are we
so-
doing? Somebody
so
tell us.
I was
What's
tell-
the plan?
So here's the plan.
All right, tell me.
So what we'll do is, let me explain.
Okay.
Okay. So one of the activities that I believe both settings will do is talking about emotions and feelings, which is always very difficult when you just sit in a group and say, how are you feeling today? So what we do and what we have is we have a big blow up ball with a bunch of different questions, and to kind of make it fun, we usually toss it. Again, introduction. So here's where you've got social skills. If you don't know somebody's name, what do you say? My name is Chris. And if I don't know your name is?
Hi, I'm Josephine.
Exactly. Okay, so then I'm going to toss it to Josephine, and wherever your thumb lands, doesn't matter which thumb, you answer the question.
Okay, so we're going to pretend our listeners are also Josephine. This
Yes.
is the question coming to you.
So think about the question and then just answer the question.
Good catch.
All
Good
right.
catch. Very good.
I'm
All
gonna
right.
go with my right thumb. It says, name something that makes you happy. What really made me happy was going to Disneyland. But the idea of the memories I've had of Disneyland still makes me really happy. Now, when is it going to open back up? I do not know, but I hope it's soon.
So here's where we would elaborate. What is your favorite memory of Disneyland, being at Disneyland?
Oh my gosh. I go there just to people watch. Is that weird? I go for 2 hours.
As long as
Seriously.
coffee or some, of
You
just
just- oh, yeah.
pastry.
I
There's
don't
something
even need to go
relaxing
on a
about
ride.
watching people.
Yeah, I just go in, go for a walk. It feels like you're not even in California. You feel like you're somewhere else. It's amazing.
It is interesting that this is not the first time Disneyland has come up in a podcast episode. we may need to reach out for
It's the happiest place on earth.
It is. All right, I'm gonna pass it to Gracie. Ready? Ready?
Nice
Alright.
catch.
Says, name something that might make you feel anxious. Ooh, that's a good
That's a good question.
Sometimes, it's weird because we're here talking together, so probably public speaking sometimes makes me very anxious sometimes, even though I'm a rec therapist, but I still get sometimes anxious being up front, leading a group of people, so.
Oh.
But it just makes me very anxious sometimes. So that's public speaking here.
So here's a good question to follow up with that.
Okay.
What can you do to help reduce your anxiety?
Oh, okay. Well, I mean, laughing has always helped me. Just kind of like how I probably did a joke, cracking up makes me reduce that stress if I'm feeling more comfortable. Like right now, I'm feeling more comfortable with you guys as we're speaking. So, yeah, like a joke would be a thing that probably would help me.
This is a good segue as well, not just for patients. It's as COVID has hit, it has increased the amount of time people are spending together that they normally wouldn't. Okay, couples, who, if people are working, you're not spending all day together, and now all of a sudden you're thrown all day together. Parents and children, your children usually are in school all day, so you see them in the morning and then you see them in the afternoons, but now you have them 24/7. And that has been a huge adjustment. We're talking about individuals who are just stressed, they're overwhelmed, they're depressed because they're having to be the teachers, and the subject matter is confusing, and it's overwhelming to learn all of the platforms that the students are having to be in. And is your child learning? So again, this can create stress and anxiety. So it's important to also talk as family, and simple games. This one, we're tossing a ball that has words already written on it. But this could be done at home. You can get a beach ball and write your own questions that you can have an open forum with your family, with your friends, and create conversation in a setting that makes it a little bit more comfortable and fun. Simple board games, you can add fun questions. When was your happiest memory? As Josephine was talking about that. So it's trying to find different ways to manage the current situation that we have. Again, we're dealing with having to redo everything that we have ever known.
Thank you so much for walking us through the game. That was great. I'm glad it didn't come my way. No, I'm just kidding. So, all right, I'm sure that this is all wonderful, but I'm sure you have stories behind the scenes where an activity or an event maybe didn't go quite as planned. Can you give us maybe the bloopers episodes of some of your events?
Forgetting to bring, one vital piece of equipment, glue. Or
glue. I think that could be important. Yes. Okay.
Or you walk in with an idea and everyone there is absolutely not in the mood to do that. So it's just, okay, what shall we do today? And sometimes, you go in with one idea and you come out with a whole different aspect. I do recall one time going in with a creative expression activity and everybody was in a bad mood, and it turned into a stress/anger management group and processing because everybody was having a bad day.
I actually do have one recently. I was trying to do a self-esteem session with this one patient. So I brought in all the equipment. And I did remember she asked me to bring the game Scrabble. So I did bring it to her, but as kind of more of a backup. So I introduced her to this game, and she was very difficult to kind of deal with, very paranoid. And she's like, I don't want to do that. I don't want to do self-esteem. So I'm like, okay. So then she's like, how about, okay. So I had to kind of think, and well, it's something that she likes to do, so she did mention Scrabble, so I brought in the Scrabble. It's like, all right, let's come up with some words, some positive words about yourself.
Okay.
So that's kind of how I incorporated that with her, and she was able to calm down. She was very frustrated about that morning, about so many questions with the doctor, so I kind of had the opportunity to kind of bring her in, in the day room, just me and her, kind of de-stress from that and focus on an activity that she liked to do.
Yeah, but I can recall a story to where we were working with a patient, and the team in their notes would always say he's non-compliant, and so I was working with him, and we were doing some tabletop activity games, and he just didn't want to do it, and I want to go back to my room. But later, with working with a gentleman, the reason why he was quote-unquote non-compliant is because he didn't know how to read. So the activities that we were providing him, he just couldn't read it. So we changed the whole trajectory of what we were going to do as far as a plan. So I asked him, I said, would you like to learn how to read? So at that time, my kids were really small, and I know as rec therapists, we do age-appropriate activities. But I asked him if it was okay if I can bring some of those books in, and he said, yeah. So every day I saw him, and we just practiced on reading. And so this story still makes me smile. So we have what we call family conferences, just to, when the family comes in or the care provider, to see how, this patient is doing and what needs this patient will need when they're discharged to a home setting. And the daughter said that she had his granddaughter wrote him a card. It was a birthday card. And she said for the first time her dad was able to read the card.
Wow.
And it still touches my heart, when I think about that.
That's such a touching story.
Yeah,
Thank you
I
for
still like that story.
sharing.
Aw.
I'm sure you all have a lot of special moments. And as we conclude, I wonder if you wouldn't mind sharing a special moment or time, maybe with a patient or an encounter that touched your heart.
I think the one for me that stands out the most in my 27 years, I was working for LA City Rec and Parks in North Hollywood. It was a day program for adults and seniors. There was this one individual, one female. She was very limited in her vocabulary, and every morning I would greet her and say her name. And I was there for several years, and nothing in return, just a smile. And I remember, I think it was 2 years in, she responded one day with, "Good morning, Cree." And it was like, what? She goes, "Cree, Cree, Cree." Because I would say good morning, and I would say, "It's Chris." So she couldn't say the full name, but so from that point on, when I would say good morning, she would always come back with this huge smile on her face and say, "Good morning, Cree." So for me, that just was repetitive, and where I say sometimes we don't know how we affect individuals until sometimes maybe much, much later, where we see it from them or we hear a family member tell us, and it feels good.
For me, it's been special this last year just because, and we were talking about our community activities and stuff like that. So these are clients and patients that we saw monthly, weekly. So since COVID and not having those activities, it does make me feel very good when I get text messages, emails like, "Hey Josephine, how are you doing? Like, happy holidays." It's very special to me just because, I know they have a lot going on, but for them to like actually really miss us, we really, really made a big impact in, just their like daily life in general. So that's really what came to my mind first when you asked, in terms of during the pandemic.
One of the things we do at Rancho, and a lot of places do, is animal-assisted therapy. And you would be surprised how much an animal can affect someone. Because we have pictures of animals framed in our house. So there are times where a patient will not want to get up. But if I say, Willis is our lab and Zoe is our umbrella cockatoo, Willis or Zoe is going to be in this session, then they'll get up. And lots of times it's emotional because they miss their own animals. I've had therapists, because we do a lot of co-treatment, tell me that their patient, never said a word, or this is the first time they've seen their patient smile all week. So it's just amazing what a difference animals do, and I'm just so grateful that we have the opportunity to incorporate animal-assisted therapy in our treatment settings.
Well, I want to thank you all so much for joining me today for this lovely episode, and thank you so much for everything that you all do for our teams and our patients and our community.
Well, thank you for having us and being able to talk about recreation therapy.
Thank you for tuning in today. Make sure to follow us on Instagram and Twitter, and to subscribe to the LAC+USC Medical Center YouTube channel, where you can find all of our previous episodes, in addition to the episodes located on anchor.fm/House Calls with Dr. K. We also want to hear from you, so email us at lacuscpio@dhs.lacounty.gov. Thank you for tuning in, and see you next week.